Well, I have been a nurse practitioner in the state of Missouri since 1979, and before there were a lot of laws there. And since that time, we've accumulated many laws which have continued to become more restrictive. Missouri is one of the most restrictive states in the nation, and so I have been very active in trying to change things legislatively. I'm the president of the Association of Missouri Nurse Practitioners, and I was just the advocacy chair for that group as well as the vice president. And so I've been active in Jefferson City, Missouri, our capital, trying to get legislators to recognize that improving access for Missourians would certainly be part of what nurse practitioners could provide. I think that in our community, the policy that would best be affected would be to eliminate our collaborative practice arrangement. We have one with physicians, but we have to be within 75 miles of that physician to be able to practice. And Missouri has been a very restrictive state. And so I think that allowing the nurse practitioners to work to the full extent of their certification, their training, and their education would be a godsend, because 109 out of 114 counties in Missouri actually are considered to be underserved in primary care, and for psychiatric care it's 114 of 114 counties. So providing more access by getting rid of the collaborative arrangements and the geographic barriers would certainly improve care in Missouri. Well, I actually had a gentleman who came into the emergency room when I worked there, and his family was saying that they thought that they believed that he had the flu. And because of the thorough history that I took along with my assessment, I decided to do a CAT scan of his head. He didn't have any neurological signs at all at that time, and he had talked about he had stumbled and hit his head. And when I had the CAT scan result, it showed that he had bilateral subdural hematomas, which meant that his neuro exam was perfectly normal despite the fact that his head was filling with blood. And so he was flown to the St. Louis area, and that was just a real eye-opener for me, always to go ahead and try to do the best assessment based on the history that you get as well as your physical assessment. And even if symptoms may not be present at that particular time, you want to make sure that you're thorough and don't make errors. The practice pearl that someone taught me when I worked in the emergency room is don't ever order what you don't want to take care of, because sometimes people make extensive ordering just to try to capture everything, and then they're not really sure what they have. So I always try to be specific about what it is that I want to assess, and specifically order things to assess that. I think that my research and scholarship have influenced my clinical practice by giving me more and more information. Whenever you're involved in research and you actually have data to demonstrate what your outcomes are and how good they are, it drives you to strive further to try to make those outcomes better and better. Our grant in Missouri was one of 7 that CMS did across the country in nursing homes, and Missouri led the 7 states, and my nursing home led the state of Missouri in outcomes. So we did reduce hospitalizations by reducing transfers to the hospital. We pretty much eliminated emergency room visits, which would be considered potentially avoidable. We also had not used any antipsychotics in dementia since, I believe, July of 2014, and got record number of advanced directives done for people, and volunteered that to our community setting to try to get people involved and recognize that having a power of attorney and people that they trust to direct their health care was really important. So we did a lot, as well as reducing polypharmacy. So many people are taking pills that are for side effects of pills that they're taking, and People, they go to different doctors, and different providers don't really look at the original list, and people end up with pages and pages of medicines, and that not only is a burden, but it's also very expensive to do. And so oftentimes you find that if you reduce some of those medicines, people actually get better because they don't have interactions and they're actually feeling better and less drugged.